another edition of Raising the Bar. I'm your host, Alan Pickert. Today's episode is presented by Terrell Hogan Law. It's a boutique litigation firm that's been in existence for over 50 years, located in downtown Jacksonville, Florida. Today we have a very special guest. Today we have Dr. Laura Grippa, who is probably the smartest doctor I have ever met in my life, and personally was very instrumental in helping me when I went to an ER with a cancer issue several years ago, and she was the ER doctor, and we had emergency surgery and all that good stuff. But beside all that, literally the smartest doctor I've ever met. Dr. Grippa, Laura, great to see you.
Good to see you too, Alan, and not in that setting.
So let's talk a little bit about, you are an ER doctor. Let's talk about your background. You went to Harvard.
I went to Harvard undergrad.
And then where'd you go to med school?
I went to Albert Einstein College of Medicine.
I told you she's the smartest person I know. I told you. Go ahead. And then you've been over at Baptist for how long now as an ER doctor?
I went to the University of Florida Emergency Medicine program here at it used to be called Shands, now it's back to U of F from 1998 to 2001, and I've been at Baptist Health since 2001.
Wow.
So 23 years. I'm almost the oldest doctor there.
Almost. Very good, very good. So tell us, I know you can't go in specifics, but can you give us kind of a range of the types of cases you see as an ER doc? Because I've got to admit, they've got to be ranging from A to Z.
Yeah, and it is. You know, people always say, oh, do you see trauma? Do you see gunshots? And where I am now at Baptist, it's a tertiary care center, and I see everything. And one of the things I love about working there is I got a pulse on the whole community. I can take care of a CEO who's having chest pain because he's in charge of $1 billion takeover and he's having a heart attack. Or I could be interacting with a person who's homeless due to mental health issues. Or I could be talking to people who come in for fear of COVID, who don't come in for fear of getting COVID. So it's a neat place to work because over 24 years, I kind of get a pulse on what's happening in the community around me. And I think, you know, were I not an emergency physician, I wouldn't know. I would just live in my bubble, as we all kind of live in our bubbles, and not really be able to see what's happening in society as a whole. So that's one of the things that has always attracted me to emergency medicine.
So I'm kind of curious about this. I've always wondered this about COVID. Were you more busy or less busy during COVID?
You know, it came in waves because, you know, as any virus knows, when the flu season hits, it comes in a wave. Everyone has a cough, everyone has diarrhea, everyone has vomiting. Well, COVID was very similar. And so when the stuff was happening on the news in New York, we didn't get hit with the influx. It was actually shockingly quiet the first few months. So my neighbors would all drop off things. They'd say, you're a healthcare hero. I even did a photo shoot on a big, on the bridge with one of my friends who's a newspaper reporter. And it was quiet, eerily quiet. No numbers. And then what happened is the surge of all the sick started coming. And then it got crazy busy where, are we going to run out of oxygen? How's it going? You know, Baptist was on the forefront of preparing. They set up emergency tents so we didn't get overwhelmed with patient volume. So it ebbed and flowed based on the virus and how it was affecting people. So it was a really dynamic time to work.
So I know when you work, is it 24-hour shifts?
No,
Oh,
not
okay.
anymore. During residency and training, those 4 years, yes, we would be on call 24 hours and stay the next day. But no, ER physicians work in tents for 8 to 12 hours. My shifts tend to be 8 to 10 hours. And when I'm there, I am 100% focused, like being in a pinball machine. The phone's ringing, like an air traffic controller would be probably a similar type use of skills, except applying to medicine.
Well, when I've seen you in action, it's unbelievable because there is zero downtime. You're not even going to get a drink of water. You're going from here to there.
I purposely don't drink water because I don't have time to go, relieve myself.
Sure.
And then I even made kidney stones once during a shift, and that was very painful. I almost passed out.
Oh my goodness.
Yeah.
So as if you weren't busy enough with being an ER doctor, you also are involved with CMA medicine.
Yeah.
Tell us what CMA medicine is.
So CMA medicine is a fantastic aesthetic practice run by a medical doctor, Dr. Kanika Shallon. She was one of my best friends in Jacksonville. I actually interviewed her to be an emergency physician 24 years ago. But then she went out of emergency medicine and started Center for Modern Aesthetic Medicine, CMA Medicine. And she is a world thought leader in energy-based devices, lasers. She works for Candela Laser. So the way I got into this aesthetic practice and looking at energy-based devices, when we say aesthetics, people think Botox fillers. So much more. I mean, there should be a residency in aesthetic medicine.
Oh, wow.
It is so complicated. We can treat anything from port wine stains that are disfiguring to scars to just simple facial rejuvenation, even preventing cancers. Dr. Shallon just ran a study at the Candela Institute that she flies up to Boston, where they found that if they use energy-based devices, specifically our light and bright treatment at CMA Medicine, that we can reduce keratinocyte skin cancers, meaning basals and squamous cells. The ones you go to the dermatologist and they scrape off and they burn and scrape. Well, if you do this annually, you can slow cancer. Not to mention looking great, getting rid of your dark spots and your redness and increasing the collagen in your skin and the elastin. So not only are the energy-based devices, all these lasers, important for a youthful glow, they're important to prevent skin cancer. Wow. So that's fascinating. I mean, so that's kind of how I got into it, because I called up Dr. Shallon and I said, hey, I love emergency medicine. I'll always be an ER doctor till I die, till I can't read, the x-rays. But as something new to move into aesthetic medicine. So I've been working with her for about 4 years and absolutely love it. It's a whole different practice. I can be coding someone at midnight, dealing with a stroke and having, dialogue with our amazing stroke interventionalist at Baptist. And then the next morning I'll be talking to someone about what their goals are, with their skin health, what their concerns are. And that's a slower pace. 2
locations for CMA
Yeah,
medicine?
We have one right down the road, 6 minutes. I just finished with the patient. I was like 6 minutes to get to the show with Alan.
Okay.
And then the other one we just opened at the beach. It's a beautiful state-of-the-art facility. It has, I think we have over 40 lasers there. It says CMA Medicine, and it truly is medicine, and that's why Dr. Shallon picked that name. But everyone doesn't really realize it's an aesthetic clinic. So people we've heard think it's a doctor's office or one of those new marijuana pop-ups. So when you drive by, it's on A1A and 4 North on the ocean side, and that's where it's a CMA Medicine, because it is medicine. This aesthetic practice is incredibly complicated, interesting, but it is a type of medicine.
And the other one, because you said 6 minutes away for our viewers, we're in San Marco, so that's where the other one is. I want to talk about something that you do that I think is really, really neat, community service-wise. And you spend a week going somewhere to help people in need. Tell us a little bit about that.
If you want to call it community service.
We're going to call it community service.
It's a hybrid of community service. So 1 week a year, sometimes twice a year, I go to Cat Cay Island, which is a private island in the Bahamas, about an hour and a half by boat from Miami, and I'm the island doctor. So essentially, I am charged with taking care of everyone that works on that island to support the members of the Cat Cay Yacht Club, as well as any emergencies that should arise. So that has been an incredibly expansive experience.
Because there's not a doctor on the island, so there's kind of like they're saving up, waiting for you to show up.
It's funny. I do hear from some of the Bahamians that when Dr. Grippa shows up, like they're all excited. Some of the women, because I'm one of the women doctors there, will come down and tell me their woes, and we can talk about female health and stuff like that. But yeah, it's a great experience. I work the clinic 1 hour a day. And in exchange for that volunteer time, I get to relax on a lovely island and meet wonderful people.
Well, they haven't called me for pro bono legal service down there, but if they do, let them know I'm available. Let me know I'm available. What do you like to do with your free time?
So my free time is my 3 kids. I'm a single mom with 3 college-age kids. So prior to that, it was running to soccer. Your previous guest was talking about coaching soccer. I coach basketball. I coach soccer.
You do like people.
Yeah,
You're very good.
I love people.
I mean, it's interesting how many people know who you are, and they all speak very highly about you.
Well, thank you. Not everybody. Every once in a while, I run into someone that's like,
I always ask this of my legal clients guest. But I was wondering on the medical side, do you ever have a case where you just, it kind of stands out for whatever reason, the circumstances was such uniqueness, or it was, it was so horrible and you had this great result? Or is there anything that kind of stands out? I know you have a bunch, but is there one particular one for any reason that just really kind of strikes your fancy on?
So, there's always the cases that are exciting, you hear about in the news, they'll publish it, but it's more about where my headspace is, and trying to really be a healer and trying really to listen and care for my patients. And it was a morbidly obese, homeless guy, poorly kept, covered in urine. And he came in as an overdose, wouldn't get up, sleeping. And we see a lot of people that use the ER just as a place to go. And I went in there, and at the time I was a little stressed, and maybe I wasn't in my best mood, but I was professional. And I said, "Sir, how can I help you?" And just really connected with him. Just really want to understand, what can I do for you? And even though in the back of my mind I was a little bit like, okay, I got 2 heart attacks, a stroke, I got a broken leg, I got to relocate that hip, I got a lot to do, buddy, in my head.
Right.
Instead, I approached with love, a loving heart. And at the end of it, it was amazing. He sat up, he interacted with me rather than playing possum, like he didn't want to interact. And he said, "Can I read something to you, Doc?" And he read me the most beautiful poem I've ever heard. And it was like, he could be a Nobel laureate. I mean, the poetry was unbelievable. And this was a homeless, disheveled, disenfranchised, mentally ill person. And I just felt like it gives me chills now. I still think about it. And I just think, I'm so glad that I was able to stop, take the time, and treat him like a human.
Wow.
Which I've been guilty of not doing. We have all been guilty of not doing from time to time, I'm sure, under stress. But that's a standout case for me. He was in room 6. It was probably 15 years ago.
Wow, what a memory. Yeah. I told you, she's brilliant. She's brilliant, and she's caring, and she's just a wonderful person, a wonderful doctor. Before I let you go, Laura, is there anything you would like to tell a potential patient that's coming to the ER? And I know, because obviously they come into the ER under severe circumstances. But is there anything you'd like them to know before they get there? Like, look, there are other people there in the same type of circumstances, and we're doing the best we can. Or is there any advice you would give anybody, like relax and we'll get to you? Or is there any thought process there? Because when, I've been there firsthand. I was a person that never needed a doctor in my life until 3 years ago. Never. And then it looked like chaos. It looked like a MASH unit. There were people everywhere. I just had no idea that there were so many people needing ER services when I happened to have to go in. But is there anything you'd like people to know, like before they arrive, like any advice or anything like that?
I mean, I get more upset when people don't speak up in the waiting room and they have a significant problem.
Okay.
So there are times when things are crazy and there is a backup and someone may not get back for an hour, and then I see them and I'm like, oh my God, why didn't you say something? So I personally don't mind when people speak up for their concern and let us, look at you and say, okay, this is an emergency. Because something as simple as, I got a little tingling on my right arm. In the right person, that can be an acute, impending, catastrophic stroke. And so don't minimize it, but be polite. Understand we're all trying to help you. Bring a blanket. It's freezing cold.
That's
and
a good
if you
one.
can, eat a snack, because usually we don't let you eat once we get our diagnostic test going.
Very good. Very good. Well, Dr. Grippa, thank you so much for joining us.
Thank you.
It's been an absolute pleasure. This is another episode of Raising the Bar. I'm your host, Alan Pickert, and like I truly say, this is the first time I've ever said this in an episode. Dr. Grippa truly is a truly wonderful person, and I wish the world had 10,000 more of her, because the world would be a better place. Have a good day.